My rant and tears for change. Ford is like a large onion. His story we all know, and well, it has many complex layers. And like an onion, it literally just makes me want to cry. The story has not revealed all the complex layers. Yet, we know more will most likely be disclosed as investigators peel back more findings. I have no tears for Rob Ford. Surrounded by City Hall support staff who, like his brother, can be considered enablers. Those trying to voice concern have been pushed away and aside by Rob Ford. Well, I have tears for the fact that our society is not focusing on the bigger picture that Ford has blatantly presented to us all. It's a clear reminder that we live with many functional addicts that include and are not limited to alcoholism, illicit substance, and prescription drug use. There's also people who have serious mental health issues. It's a known fact that addiction can cause mental illness, and vice versa. Addiction and families of addicts are in all walks of life. Can we start to promote compassion for much needed support of the real difference makers that are always underfunded and due to the stigma and denial of the need that's there? Well, let's have a reality check. Normal for many people is functioning with a family member who has a mental issue or a substance issue. It's a sad sickness of denial because our society and current government puts blinders on to avoid the topic that is especially underfunded. They throw around Yordic and small contributions. Rob Ford clearly has issues that impact his ability to manage our city. His sister even publicly admits to being a recovered addict. All of the textbook signs of a family in need of intervention are in front of us. The lack of intervention and support for addicts is real. A person holding a responsible public position who clearly requires immediate intervention has not had any, because it does not exist for the powerful or the poor in our country. It takes an incredible amount of money to place a person in a private sector rehabilitation clinic. In Canada, we have a small cluster of incredible resources that cope and do their best for addicts and mental health issues. The difference makers are in larger cities, and they're not limited to some of the organizations such as CALM in Toronto, Insight in Vancouver, or how about the public volunteers in general, or the counselors and street-savvy outreach workers? Protesters for safe clinics, what about them? Or even the Canadian Olympic medal athletes. They are all on board for mental health awareness. In Canada, we need more shelters and clinics for families. And these clinics need volunteer support jobs. And these volunteer support jobs are thankless and probably save more lives than we will ever truly have statistical data on. Our country requires more passion and support for education towards supporting all these real people and families with education. And families with addiction. Sorry, not education. I'm scatterbrained. Intervention and prevention is the call to action required to assist our society in trying to regain some healthy standards. Harper Government, are you listening? Addiction rehab facilities, counselors, street outreach, and clinics are all underfunded, difficult to find, and not readily available for take action or a priority for families in Canada. Our society needs to push the government to consider making an intervention. for health a priority. Provide education properly in schools about drug addiction is another key fact in what we need. Our society needs to admit that dangerous drugs are not just illegal, and that they include accessible prescription and alcohol, education, and available brick-mortar resources will empower our youth and family members so that they can say, simply, no thanks. I have a crazy idea. And just hear me out, okay? It might sound crazy, but just hear me out. Adjust the Red Room in Canada. Remove the Senate and replace it with a federal health support strategy group. Include youth, recovered addicts in this Red Room for and what they'll be there for is to add reality advice and counsel. The current Senate budget would finance the life support line to implement more health resources. It's a concept that would be ridding the Senate. Imagine applying all the costs currently associated with that Red Room to really helping Canada with a healthy recovery plan. The Red Room could become the real room, where Canada could keep it real and address properly our needs for poverty and addiction. All reality, including our government's embarrassing lack of support to the First Nations families who really need funds, support, and resources in housing. Let's thank Rob Ford or The Onion for starting the conversation early, even though we did not want to discuss with our children the impact of crack cocaine, etc. Very young preschool kids are even asking about crack. I hope parents can find words to give real answers, because clearly Canada does not have a support system in place to assist families to properly respond to curious kids. How can a leader, a mayor, lead by such an example of poor behavior? Wake up, Mr. Harper and your government. Please don't pretend that you have not noticed a problem. Do not let it go unrecognized. This is more than our mayor. The problem includes the need for improved health care, shelters, clinics, and educated outreach for families. Every Canadian would like to have good physical and mental health. That's what I meant to say. Education for prevention is proactive, and so is intervention with support. Harper, stop ignoring these health issues related to mental health, addiction, or our soldiers with post-traumatic stress disorder. Canada needs to keep it real with outreach support for civilian, rural, city, suburban, and First Nation reserves. I think that our government needs to add it as a priority. Fund organizations that are difference makers for a healthy Canada. Please get Rob Ford some help and stop the tears that this epic Rob Ford onion of leadership has caused all of us.